Health Secretary Robert F. Kennedy Jr.'s newly appointed Vaccine Advisory Committee is making its first round of recommendations. And today, the 7-member panel voted to stop recommending flu shots that contain thimerosal. It is a preservative that has sparked plenty of theories over vaccinations causing autism in children. We should point out that claim, though, has never been scientifically proven. Despite that, most manufacturers have voluntarily removed it from childhood immunizations. CBS News health reporter Alex Tin has been following all of this and joins us now. Alex, thank you very much. What was behind the panel's decision on the use of thimerosal?
Yeah, so just to be clear, the panel's decision came after one presentation, not by the usual CDC process where, the staff of the CDC convene all these experts to really vet the evidence and come to a conclusion about what the impact and need for certain changes in the recommendations are. But instead, it was a presentation by Lynn Redwood. She's the former head of Children's Health Defense. That's a group that a lot of folks have criticized as anti-vaccine and that Health Secretary Robert F. Kennedy Jr. is the founder of. She is concerned, and she aired a lot of those debunked concerns about thimerosal at today's vaccine meeting. You heard a lot of the vaccine members picked by Kennedy say that they agreed with her concerns and thought that it was long overdue to remove this vaccine. There was one exception, Dr. Cody Meisner. He said he disagreed with the decision and that he agreed with the vast majority of health groups who say there is no evidence that thimerosal is a safety concern in vaccines.
And Alex, when we talked to you yesterday, you mentioned how the panel postponed its vote on RSV antibody shots for infants. They did, though, take that up again this morning at the start of the meeting. Walk us through that decision.
Yeah, this one's interesting. Folks might remember there is already an RSV vaccine that is approved for pregnant women. For pregnant women who don't get the vaccine before giving birth, there is already one RSV antibody shot that can be given after birth. The question today was whether a new RSV antibody shot, essentially a competitor to that first one that was approved, would also be recommended. The committee was actually split on this. Some folks were concerned that maybe healthy babies shouldn't be getting RSV antibody shots at all. But a majority of the committee did end up deciding that, indeed, they recommended getting this second antibody shot as an addition to the first one in case folks decided to choose so.
And Alex, I also want to ask you about fall flu vaccines because the committee also voted on recommendations for those. What did they decide there?
Yeah, what's interesting here is that folks thought that there would be a dramatic change potentially to the fall flu vaccine recommendations. That did not happen. Actually, there was barely any discussion of that vote at all. The panel essentially just went to the end and decided we approve basically what the panel has previously approved under the previous members who were fired by Health Secretary Robert F. Kennedy Jr. and replaced with this new roster.
Yeah, on that note, the panel has gotten quite a bit of backlash after the health secretary handpicked some of those anti-vaccine voices. How do you think today's recommendations reflect that?
Yeah, we heard a lot of criticism, not just about the specific people who were chosen to serve on this committee, but the process changes that they're bringing with them. There's a whole bunch of changes that they now want to do, some that are revisiting long debunked concerns about vaccine safety and also bypassing the usual career processes that are run by career officials at the CDC that rigorously essentially vet and understand and look at the evidence that is usually supposed to inform these recommendations. It's clear now that process is being put by the wayside. And just to take one example of it, there was a lot of concern about thimerosal that was debunked in a CDC review that was posted on the agency's website. That was taken down ahead of the meeting.
All right, Alex Tin, thank you very much. We appreciate your time.
Thank you.